Pain under the right ribs, feeling heavy after eating fatty foods, bloating that seems to appear out of the blue, or an unpleasant bitter taste in your mouth in the morning? Stop. Don't rush to ignore it. Often, these signals aren't coming from your stomach at all. Not what people think of first. Hello. My name is Olivia Voss, and you're on the channel about health and healthy living. Here we discuss symptoms that many people tend to attribute to eating something wrong, but in reality, they may be due to completely different, deeper processes. Today, we'll talk about the gallbladder, how it affects your well-being every day, and what signs really shouldn't be ignored. Watch to the end, and you'll learn how to distinguish harmless discomfort from a condition that requires medical attention. And an important point, everything I'm sharing is for informational purposes only. This is not a replacement for a doctor's appointment or a personalized recommendation. Let's get one thing straight. Pain in the right upper quadrant is not a diagnosis. It's a signal. It's the body's reaction. And the doctor's job is to understand where it's coming from and how serious the condition is. The gallbladder is a small organ, but its impact on well-being is much greater than it seems. It's located under the liver on the right side. The liver constantly produces bile, and the gallbladder stores it and releases it when needed. When you eat, especially fatty foods, the gallbladder contracts. If everything is working properly, you won't feel it. If not, symptoms appear. And most often, they occur through discomfort or pain. And here's where things begin that many underestimate. Something that doesn't cause sharp pain or disrupt your daily life, but it gradually creates a problem. We're talking about functional disorders, and first and foremost, about gallbladder dyskinesia. It's important to understand one key thing right away. Dyskinesia isn't organ destruction, inflammation, or the presence of stones. It's a dysfunction, a disruption in how the organ works, how it contracts, and how it reacts to food. And that's precisely why this condition often goes unnoticed, because people think if nothing serious is found, then everything is fine. But in reality, this is the first stage, the starting point for the development of more serious diseases. Now let's take a deeper look at how the gallbladder normally functions. After eating, especially if it contains fat, the organ receives a signal. This signal is transmitted through hormones and the nervous system. The gallbladder contracts and releases bile. Bile enters the intestines and helps digest food. It's a precise and synchronized mechanism where every detail matters. Now imagine that this mechanism begins to malfunction, and this malfunction can occur at various levels. At the level of nervous regulation, at the level of hormones, or at the level of the organ itself. And as a result, the system begins to function unstably. Now the key point, dyskinesia comes in different forms, and this is fundamentally important to understand. There are two main types. The first is hyperkinetic, when the gallbladder contracts too actively, too sharply, sometimes even chaotically. A spasm occurs, and this can cause pain, sometimes sharp but short-lived. Such pain often occurs due to stress or after eating. The second type is hypokinetic, when the gallbladder is sluggish and doesn't contract sufficiently. Bile stagnates, creating a feeling of heaviness, distension, and discomfort. Sometimes there's a dull, aching pain. And here's a very important point. Both types can cause similar complaints, but the mechanisms are different, and therefore the approach to correction will be different. Now let's look at the reasons why dyskinesia occurs in the first place. And here we come to the most important block, lifestyle. The first factor is diet. Irregular meals, skipping meals, long breaks. This is one of the most powerful triggers because the gallbladder needs to function regularly. If it doesn't contract for a long time, bile accumulates, stagnates, becomes thicker, and this is already the first step toward developing a problem. The second factor is stress, and here the connection is much deeper than it seems at first glance. The gallbladder is directly connected to the nervous system. Chronic stress causes spasms. The coordination of contractions is disrupted, and symptoms appear, sometimes even without obvious changes on ultrasound. The third factor is hormonal changes. They affect the composition of bile and the motility of the gallbladder. This is why some patients may experience periodic worsening of symptoms. The fourth factor is a sedentary lifestyle. Movement isn't just about muscles. This is about stimulation of internal organs. With low activity, stagnation increases. The fifth factor is a sudden change in diet. Crash diets and sudden weight loss can also disrupt gallbladder function. Now about the symptoms. And here's the key feature. They are rarely pronounced. More often, it's periodic discomfort, heaviness after eating, a feeling of fullness, sometimes pain, but not sharp, but rather a nagging pain. There may also be bloating, unstable stool, a bitter taste in the mouth, sometimes nausea. And all of this is often perceived as something I ate wrong, and the person doesn't pay attention to it. But the problem is that these symptoms are already a signal that the system is not functioning properly. Now, a very important point. Dyskinesia itself does not destroy the organ, but it creates conditions for the development of other diseases. First of all, bile stagnation. And stagnation is a risk factor for stone formation. Thus, we get a logical chain. Dyskinesia, bile stagnation, changes in composition, stone formation, and that is precisely why it is so important not to ignore early symptoms. Now about diagnosis. It is very important to understand that a diagnosis is not made solely based on complaints. Confirmation by ultrasound and an assessment of contractile function are necessary. Sometimes additional studies, and only then can we discuss the type of disorder. Now about the approach to correction. And the key here is not one pill and it's all over. It's a lifestyle change. Regular meals at intervals, stress reduction, physical activity, and if necessary, medication support. But it's important to understand that without changing habits, the effect will be temporary. Now the main conclusion, dyskinesia is not a harmless condition. It's an early signal that the system is no longer functioning properly. And if ignored, the next stage can be stones and then inflammation. And that's precisely why it's important to respond promptly, because at this stage, the situation can still be reversed without serious consequences. Now let's move on to the next level of understanding this topic, to conditions where there is not just a functional disorder, but actual structural changes. We'll discuss cholelithiasis, a condition in which stones form in the gallbladder. And here it's important to dispel one common myth. Stones don't appear suddenly. It's not a case of, yesterday everything was fine and today there's a problem. In the vast majority of cases, it's a long-term process that develops gradually, over months or even years. It all begins with a change in the composition of bile. Normally, bile is a balanced system containing a certain ratio of bile acids, phospholipids, and cholesterol. This balance ensures its fluidity and normal function. But if this balance is disrupted, bile becomes thicker and more viscous. Under these conditions, microscopic crystals begin to form. They can't be felt, they don't cause symptoms, and the person is completely unaware of the changes taking place. Over time, these crystals coalesce, increase in size, and form full-fledged stones. And at this stage, what's especially important is that a person may still not experience any noticeable symptoms. This is a key point. The absence of pain doesn't mean there's no problem. Now, the logical question is, why does bile composition change in the first place? There are several reasons, and they most often work in combination. First, diet. Excessive consumption of fatty, high-calorie foods, especially those high in saturated fat, affects cholesterol metabolism and bile composition. Second, prolonged periods without eating. When a person eats irregularly, the gallbladder doesn't contract in time, causing bile to stagnate and become more concentrated. Third, a sedentary lifestyle. Movement directly affects the motility of internal organs, and a lack of it increases congestion. Hormonal factors and genetic predisposition are also important. Some people are predisposed to changes in bile composition, and under certain conditions, this can manifest as a disease. Now let's look specifically at bile stagnation. It's one of the key mechanisms. The gallbladder must contract regularly. This occurs in response to food intake, especially if it contains fat. If meals are irregular or a person frequently skips meals, bile accumulates and stagnates. Over time, it thickens, creating ideal conditions for the formation of crystals and subsequent stones. Once stones have formed, two main scenarios are possible. The first is that the stones remain immobile. They are located in the gallbladder cavity, do not interfere with the flow of bile, and the person may not even be aware of their presence. The second scenario is when the stones begin to move, and this is where symptoms appear. If a stone enters the cystic duct or begins to block it, the flow of bile is obstructed. Pressure within the gallbladder increases, causing pain. This condition is called biliary colic. The pain is usually quite intense, occurs suddenly, and is localized in the right upper quadrant. It is very common for it to radiate to the right shoulder blade, shoulder, or back. An attack is often triggered by eating fatty foods, because fat stimulates gallbladder contractions. If a stone is obstructing the gallbladder at this point, severe pain occurs. However, it is important to understand that an attack can also occur without any obvious provocation. For example, if the stone has moved on its own. Now, another important point, the size of the stones. Intuitively, it seems that the larger the stone, the more dangerous it is. But in practice, this isn't always the case. Small stones are often more mobile, more easily entering the ducts, and more often causing acute symptoms. Larger stones are generally less mobile and can remain in the gallbladder for a long time without causing significant symptoms. However, this doesn't make them safe. They also require monitoring. It's important to note that symptoms may be present even outside of attacks. These may include heaviness after eating, especially fatty foods, a feeling of fullness, bloating, and sometimes a bitter taste in the mouth. These symptoms are often perceived as minor and not associated with the gallbladder. However, they reflect a malfunction of the system. Impaired bile flow affects the digestion of fats, and therefore the entire digestive process. Furthermore, bile is involved in regulating intestinal microflora, and insufficient intake can lead to additional intestinal problems. Thus, gallstone disease can remain latent for a long time without any obvious symptoms, but still pose a risk of developing acute conditions. And very often, the first significant episode is an attack of biliary colic. This is why it is so important to pay attention to even mild, recurring symptoms and not delay diagnosis. In the early stages, the possibilities for managing the situation are significantly greater. This allows you to avoid complications and maintain quality of life without more serious interventions. Now let's take a closer look at one of the most common conditions patients face: cholecystitis. This is an inflammation of the gallbladder which can manifest itself in different ways, sometimes acutely, with pronounced symptoms, and sometimes gradually, almost unnoticed by a person. And this is precisely its insidiousness, because for a long time, a person may ignore the symptoms and miss the opportunity when the problem could have been solved much more easily. There are two main forms, acute and chronic, and they differ fundamentally, both in their development mechanism and in their clinical picture, as well as in their possible consequences. Let's start with acute cholecystitis. This condition develops quite quickly and is most often associated with a blockage of bile outflow. In most cases, the main cause is a stone that blocks the cystic duct, preventing bile from flowing normally. It begins to accumulate and gradually increases in volume inside the gallbladder. Pressure. What happens next? High pressure disrupts the blood supply to the bladder wall. The cells begin to experience oxygen deficiency, and an inflammatory process begins, which can eventually lead to infection. This leads to full-blown inflammation, which can progress if not addressed promptly. Clinically, this manifests as a sharp pain in the right hypochondrium. The pain is usually intense and progressive. Sometimes patients describe it as one of the worst in their lives. Radiation is very common. The pain can radiate to the right shoulder blade, shoulder, and sometimes to the back. Pain often occurs after eating, especially after fatty foods. But it can also appear without any apparent cause, especially if the stone has already dislodged. Additionally, nausea, repeated vomiting that does not bring relief, fever, weakness, deterioration of general condition. And here it is important. Clearly understand that this is no longer a functional disorder, but an acute inflammatory condition that requires medical attention. Ignoring symptoms or attempting self-treatment can lead to serious complications. Now let's talk about the possible complications of acute cholecystitis. The inflammation can intensify and become purulent. In severe cases, the bladder wall may be damaged, and this is a critical situation that requires urgent surgical intervention. Therefore, if you experience severe pain, fever, vomiting, it is very important not to delay seeking medical attention. Now let's move on to chronic cholecystitis. This is a slower and more prolonged process and develops gradually, often associated with obstructed bile flow or the presence of stones, but can also occur without stones. Symptoms in chronic cholecystitis are less pronounced, which is why they are often ignored. A person may experience periodic heaviness and discomfort after eating, bloating, sometimes a dull, aching pain in the right hypochondrium. A connection with diet is very common, especially after fatty, fried, or heavy meals. However, symptoms can be unstable. Today there's discomfort, tomorrow practically nothing, and this creates the false impression that the problem is minor. In fact, the inflammatory process can persist and gradually progress. Over time, structural changes occur. The gallbladder wall thickens and becomes less elastic. Its contractile function is impaired, and it performs its function worse. A vicious cycle develops. Bile outflow obstruction leads to stagnation. Stagnation leads to inflammation. Inflammation leads to further dysfunction, and this process can last for years. It's also important to note that chronic cholecystitis is often accompanied by exacerbations, when symptoms worsen despite a relatively stable condition. It is during these periods that patients most often seek help. Now, an important diagnostic point. The severity of symptoms does not always correspond to the severity of the process. Sometimes significant complaints are accompanied by minimal changes. And sometimes, on the contrary, serious changes occur with minimal symptoms. Therefore, relying solely on sensations is not enough. An objective diagnosis and ultrasound examination are necessary, which allows us to assess the gallbladder structure, the presence of stones, and the wall thickness. Blood tests provide information about the presence of inflammation and the condition of the liver. If necessary, additional methods are used. Now, about the risks of a chronic process, the main risk is disease progression, worsening symptoms, decreased quality of life, dietary restrictions, as well as the likelihood of developing an acute condition. Therefore, chronic cholecystitis is not a harmless condition, but a disease that requires observation and monitoring. Now, an important conclusion. Cholecystitis. It's not just something after eating. It's an inflammatory process that can develop gradually or emerge acutely. And in both cases, it requires attention. And the sooner you begin to understand the causes of your symptoms, the better your chances of avoiding complications and maintaining your quality of life. Now let's look at how to properly approach diagnosis. People often try to diagnose themselves based on symptoms, advice from the internet, or the experiences of friends. But in the case of gallbladder disease, this can lead to errors. Because symptoms can overlap with other gastrointestinal diseases, it's difficult to understand the true cause without an objective assessment. The basic diagnostic method is ultrasound. This simple, accessible, and informative method allows for an assessment of the gallbladder structure, the presence of stones, the condition of the wall, and indirect signs of inflammation. However, it's important to understand that ultrasound is not the only diagnostic tool. The next step is laboratory tests. Primarily, indicators related to liver function and the presence of inflammation are assessed. This helps determine how active the disease is and whether it is affecting other organs. In some cases, additional diagnostic methods may be required, such as more detailed visualization of the bile ducts or functional tests. And here's the key point. Diagnosis is not a single test, but a system. The doctor evaluates not only the ultrasound or test results, but also the patient's complaints, the nature of the symptoms, their relationship to nutrition, their duration, and their dynamics. Only a comprehensive approach allows for an accurate diagnosis and the right treatment. This is why it's so important not to self-diagnose, but to consult a specialist promptly. Because in the early stages, many conditions can be controlled without major interventions, provided they are detected early. And now, let's summarize everything we've discussed today. Pain in the right hypochondrium is not a coincidence. It's not just a reaction to a bad meal. In most cases, it's a signal that the system is no longer functioning as it should. And it's crucial to understand one thing. The body almost never begins with severe conditions. Mild, almost imperceptible symptoms appear first. Heaviness after eating, occasional discomfort, bloating, bitterness in the mouth. And it's at this stage that a person has the greatest opportunity to influence the situation. Change your diet, normalize your routine, reduce the stress on the body. But more often than not, things happen differently. These signals are ignored. They are put off until later. And only when pain appears, truly severe, interfering with life, does a person begin to look for the cause. And by this point, the process may already be at a different level, with the formation of stones or with inflammation. Therefore, the key idea to take away from this conversation is to pay attention to yourself early on. Not when things have gotten really bad, but when your body is just starting to hint. I'd like to emphasize There's no single symptom that can tell you for sure it's a gallbladder problem, but there are combinations of signs, there are patterns, there's a connection with diet and lifestyle, and it's their analysis that provides an understanding of what's going on. Modern medicine offers all the possibilities for early diagnosis, and in most cases, if the problem is detected early, it can be controlled without serious consequences. Therefore, the best solution is to not ignore your body's signals and not self-diagnose, but to consult a specialist promptly. Because health isn't just the absence of pain, it's a state in which the body functions calmly, stably, and without constant discomfort. If this video helped you better understand your body's signals, save it so you can return to the key points. Subscribe to my channel if you want to learn more about health. Leave comments on topics that interest you, and we'll definitely cover them in future videos. Take care of yourself and your health. See you soon.